Healthcare costs don't usually announce themselves loudly. They adjust in spreadsheets first, then in projections, quietly, in your January deposit. And based on current spending patterns, the next Medicare Part B premium cycle may bring another increase. Even a $20 monthly adjustment may not sound dramatic, but for retirees living on fixed income, that is $240 per automatically deducted before you ever see it. No bill, no warning letter in bold, just a smaller net. The fall announcement window is approaching. If you rely on Medicare, this is the period that determines your healthcare deduction. If you depend on updates like this, make sure you resubscribe to Macro Signals so you don't miss critical policy shifts. Medicare covers physician visits, outpatient procedures, preventive services, and certain physician-administered medications. Unlike Part A, it requires a monthly premium. That premium is not random. It follows a formula tied to projected program cost. By statute, roughly 25% of expected Part B spending must be funded through beneficiary premiums. When projected costs rise, required premium revenue rises with now. Several structural forces are applying pressure simultaneously. Outpatient service costs remain elevated. Drug spending under Part B continues influencing projections. Enrollment growth adds additional beneficiaries. Utilization patterns have stabilized at higher levels than some pre-pandemic baselines. When these variables move together, premium adjustments become more. Retirees assume cost of living adjustments will offset these increases. Sometimes they help, but when healthcare inflation outpaces COLA adjustments, the net gain shrinks. In prior years, a meaningful portion of Social Security increases was absorbed by higher Part B premiums. The headline said increase. The deposit felt smaller than expected. Now, here is the detail many people do not anticipate. Medicare applies income-related monthly adjustment amounts to beneficiaries whose income exceeds specific thresholds. These surcharges are determined using tax returns from 2 years prior. Current income, not last month's income. 2 years back. Imagine a 70-year-old retiree who executed a $60,000 Roth conversion in 2020 to improve long-term tax efficiency. That conversion increases modified adjusted gross income for that year. In 2026, Medicare reviews that 2024, even if income has normalized, the recorded spike may trigger an IRMAA tier. The retiree could face significantly higher premiums for the entire unless they qualify for and successfully file a reconsideration request based on a recognized life-changing event. The system processes data. It does not interpret context automatically. This is where secondary pressure builds quietly. Premium increases may coincide with higher supplemental plan costs. Prescription drug plan adjustments often occur in the same annual cycle. Deductibles and copay structures, none of these changes are extreme individually, but when layered together, they can materially compress monthly margins. There is also the hold harmless provision. This rule protects certain Social Security recipients from seeing their net benefit decline due solely to Part B premium increases. However, it does not apply universally. Individuals subject to IRMAA are excluded. Those not yet drawing Social Security are not protected in the same way. New enrollees may experience full adjustments immediately. Assuming protection without verifying eligibility can lead to inaccurate. Why is this dynamic unfolding now? Demographics are predictable. The population eligible for Medicare continues expanding. Medical innovation improves treatment outcomes but frequently increases cost per service in the short term. Outpatient drug expenditures remain a significant variable. Administrative modernization improves long-term efficiency but does not eliminate immediate costs. Based on current trustee reports and spending trajectories, upward premium tension remains present in the system. Another overlooked timing issue is planning visibility. Premium announcements typically occur in the fourth quarter. Implementation follows in January. That creates a compressed window between confirmation and impact. Households that monitor projections earlier have greater flexibility to adjust distributions, spending plans, or tax strategies before changes take effect. This is exactly why staying informed matters. If you haven't already, subscribe to Macro Signal so you remain ahead of regulatory adjustments and benefit updates that directly affect retirement. Quiet formula changes often matter more than headline legislation. Preparation does not require alarm. It requires structure. Review your last 2 filed tax returns and identify any one-time income events that could influence future IRMAA calculations. Asset sales, large withdrawals, Roth conversions, or capital gains can shift you into higher premium tiers 2 years later. If your income has genuinely declined due to retirement, divorce, or the death of a spouse, understand that Medicare provides a formal reconsideration process. It requires documentation, but when appropriate, it can correct surcharges. Evaluate your supplemental or advantage plan annually during open enrollment. Compare total projected annual cost rather than focusing solely on monthly premiums. Modest plan optimization can offset other increases. Create a dedicated healthcare buffer within your monthly framework. Even $30 to $50 reserved intentionally can absorb incremental premium adjustments without destabilizing broader budgeting. Predictable systems reward proactive planning. Be aware of enrollment timing. Part B without qualifying employer coverage results in permanent late enrollment penalties calculated as a percentage of the standard. In a rising premium environment, penalties scale upward over time. Avoidable penalties compound. Looking forward, the final premium figures will depend on several variables: healthcare inflation trends, outpatient utilization patterns, drug pricing adjustments, and potential legislative refinement. If inflation moderates, increases may be limited. If cost growth accelerates, premiums will likely reflect that. Policymakers sometimes apply smoothing mechanisms to prevent abrupt spikes, but structural pressures tied to demographics and medical costs remain long-term factors. The core principle is steady. Medicare Part B premiums follow statutory formulas linked to projected spending. They are not arbitrary. They are not temporary anomalies. For retirees on fixed income, incremental changes accumulate over years. Awareness converts accumulation into manageable planning rather than unexpected strain. Next announcement cycle approaches. Monitor official communications carefully. Review your Social Security statement when updated figures are released. If your financial situation differs significantly from the tax year being used for IRMA calculations, evaluate whether reconsideration is appropriate. Administrative systems operate on documentation. Acting early prevents extended overpayment. Healthcare will continue to be one of the defining cost variables in retirement. That reality does not require fear. It requires vigilance. Track the formulas. Understand the timing. Adjust delivery. If this analysis helped you see what may be ahead and how to prepare calmly, make sure you're subscribed to Macro. We will continue tracking Medicare adjustments, regulatory shifts, and economic signals that affect everyday Americans. Share this with someone who depends on Medicare and may not realize how these quiet premium cycles operate. In systems governed by formulas, information becomes leverage, and leverage preserves stability.